antibiotics is a term used to describe medications that are used for the prevention and treatment of infections caused by bacteria, according to Akande and Shalabi and ESCG in 2023. Recent study reported that...
Can you put on your video?
Yes, ma'am.
Go on.
Recent study reported that all over the world there's been an increase in the misuse of antibiotics, and several factors such as social demographic, behavioral, and environmental are also known to affect the adherence to the rational use of antibiotics, according to Isabel et al. Problem statement. Globally, there is a major issue associated with the irrational use of antibiotics and the emergence and re-emergence of antimicrobial resistance, according to Ikuta et al. Sorry about worldwide, this bacterial resistance was estimated to have directly caused millions of deaths in 2019, while contributing approximately 49.5 million deaths overall, according to antimicrobial resistance collaborators in 2022. And researchers have also highlighted by 2020 there would be increased morbidity due to antimicrobial resistance. Study justification. Previous studies focused on community pharmacists and other healthcare workers. Very few were directed towards clients of community pharmacy. That's why this study would aim to address that. The aim and specific objectives. The aim of the study is to assess the knowledge, attitudes, and rational use of antibiotics amongst clients of community pharmacies in Port Harcourt, Nigeria. The objectives, these specific objectives are to assess the knowledge of rational use of antibiotics amongst clients of community pharmacies and assess the attitude of clients of community pharmacies towards the rational use of antibiotics and assess the rational use of antibiotics of clients of community pharmacies. Study area, study design. The study area was conducted in Port Harcourt, located within the Port Harcourt local government of Rivers State. Study design is a cross-sectional study. Study population, we have an inclusion criteria which include people aged 18 and above, and individuals who voluntarily agree to participate and provide informed consent. The exclusion criteria for individuals who were severely ill and unable to provide reliable responses, people who did not accept or provide informed consent, people who were unable to communicate effectively due to cognitive impairment. Sample size calculation is done using the Cochrane's formula, and an adjustment was made for 10% of the responses and a sample size of 383. Multi-stage sampling technique was used, and this was conducted in three stages. Communities were selected in Port Harcourt using a random sampling technique by balloting. Pharmacies were randomly selected within the selected communities by balloting. And a systematic sampling technique was used to select participants from a provided sampling frame after calculating the sampling interval within each pharmacy. Study instruments and process. Study instruments were tool used. Questionnaire, it was interview based, and the objective to be measured by the tool were to assess the knowledge of rational antibiotic among clients of community pharmacies in the study area, to assess the attitude of clients of community pharmacies towards the rational use of antibiotics in the area, to assess the rational use of antibiotics of clients of community pharmacies in the area. Ethical approval was obtained from the University of Port Harcourt Research Committee, and permission was obtained from the management of pharmacy and informed consent. Data management. Data were entered, cleaned, and coded using SPSS version 26. 100%. And table 1 shows social demographic characteristics of the respondents with the age group 21 to 30 being the largest contributors. Also, female slightly higher than the male. And this shows knowledge of rational use of antibiotics among respondents, and some of the questions asked are displayed on the results. Leftover antibiotics can be reused without consulting healthcare professionals, and some other questions also asked. And the level of knowledge of rational use of antibiotics, the attitude of respondents towards rational use of antibiotics. This is result 5. We'll still get this chart presented in result 6. Result 7 will have this. And overall, 52% of the respondents demonstrated good knowledge. This aligns with the study of Akinyele et al. 2025 amongst Nigerian communities, in et al. 2022 in Thailand. Disagree with Madoko et al. 2026 in southwestern states. However, the findings that about 1/4 of the study population possesses poor knowledge is worrisome, as this may promote the misuse of antibiotics, according to Jetta and Gilbert 2022. Adequate knowledge of antibiotics are not associated with improved health-seeking behavior, more appropriate medication practices, in et al. 2022. Furthermore, only 44.4% of the respondents in the study possess positive attitudes towards rational use of antibiotics, despite it is consistent with Akinyele et al. 2022. And even though majority of the patients, of the respondents that possess negative attitudes pose a situation of concern to public health because of opposing beliefs and negative perceptions, may encourage self-medication, discriminate use of antibiotics, incomplete dosage, and use of leftovers, according to Leaf et al. 2022. Cross-sectional study was conducted to determine the level of knowledge to practices and factors associated with the adherence of the rational use of antibiotics amongst clients attending community pharmacies in Port Harcourt, Rivers State. Based on the outcome of the study, the following are suggested. Communities should be sensitized and properly counseled on the use of antibiotics through radio and television campaigns, handbills, and posters. There is a need to strengthen education in communities to promote awareness. Awareness should involve regular organization of outreaches even in areas that are hard to reach. Federal Ministry of Health and the State Ministry of Health and other relevant bodies should enforce and implement policies guiding the dispensing and use of antibiotics, and community pharmacies should engage in the proper counseling of patients before dispensing antibiotics. In addition, information should be well communicated.
1 minute more.
By the client. These are my references.
Good. Thank you for your presentation. Please stay on this reference. Please, others, no, stay on your reference slide, please. I want others to please look up, including the 3 people that presented earlier. If they are still on the call, please look at the reference list. You can appreciate the hanging indents. This is how APA styles appears on the reference list. When we have seen this appearance, then we can check the other characteristics to see that they align. So ensure that you do your reference list like this. I hope that is taken. Since we have found one that can be used as an example, I thought it's wise to draw your attention to it. Presenter, well done. Go to your title slide. Dr. Wagu, please.
Thank you.
Okay, thank you. Presenter, first question I have, can you describe to us the area meant by Port Harcourt? Please keep it on your, okay.
The area meant by Port Harcourt, it's the area within the Port Harcourt local government area of Rivers State.
So is Port Harcourt City local government, or Port Harcourt is an area inside Port Harcourt City? I think the question is clear.
Yes,
we have a local government called Port Harcourt City local government. We also have the concept Port Harcourt, made up of Port Harcourt and Obiabo, properly called Port Harcourt Metropolis. This Port Harcourt you are mentioning, is
Yes,
it
sir.
one of these, or is Port Harcourt inside Port Harcourt City local government?
So I think this Port Harcourt is the Port Harcourt encompassing the Port Harcourt metropolis.
I may not take it like that because you have stated here Port Harcourt local government.
Local government.
I won't take it as Port
Yes, sir.
Harcourt metropolis. But the question is, this Port Harcourt you are saying, is
Yes,
it
sir.
Port Harcourt local government, or is it an area called Port Harcourt? We need to be clear.
An area
An area.
in the Port Harcourt local government, sir.
Okay, so what area is that? Which
But the Port Harcourt,
places Port Harcourt? You know why I'm asking this question? Go to your results slides on your table 1. Okay, look at table 1, yeah, where you have ethnic groups.
yes, sir.
Yes, ethnic groups. When you look at the ethnic groups, we begin to wonder whether you are talking of the same Port Harcourt.
Actually, sir.
So this is not how results done here looks like. There are other predominant, if you are talking of Nigeria, yes, this ethnic group will suffice. But when you are doing a study in Rivers State, it shifts. So I don't know where this study was conducted inside Port Harcourt. Okay, so that seems to be just from the topic alone, we can get to that point. Let's go to your statement of the problem quickly, please. There's no time. Yes, when you look at this statement of the problem, you see that this treated the issue of antimicrobial resistance, but it did not treat your topic. It did not raise any question. So no question was identified. There is no identification of problems related to knowledge, attitude, or rational use of antibiotics. So this itself does not stand. Okay.
Yes, sir.
Then I don't know, have you made this presentation to yourself before? Before
Yes, sir.
today? How many
Yes,
minutes
sir.
did it take? When you
Took me
presented
over
to
10.
yourself, over
Yes, sir.
10.
Took me over 10 minutes. Yes, sir.
Because the way you took your presentation, it could take as much as 30 minutes. So you need to present it to yourself and learn the nuances of presenting it within time, bringing out the important things. We didn't see anything on results. You did not present your result for us. You just flipped as quickly as possible, so we didn't see. Can you go to your results now? No. You are still doing the same flipping you did last time. Okay, show us result on knowledge. Show us result on knowledge. Okay. Show us result on attitude. So, the next one.
Next.
So do we have...
Go to the result that answers your first objective. That should answer your first objective. That's what we want to see. You've shown us social demographics. Let's see objective 1. Next, just slowly. Next. It can't be going backwards. We are going forwards. Next. Stay, no.
Okay. So show us the one on, start from your objective 1. Is this your objective 1? You know, the external examiner will be asking if you are the one who prepared the slide or if you did the work at this stage. Mhm. All right, over this way, Chairman of Panel, Dr. Bodna.
All right, so presenter, please, I need you to take it one step at a time if you want proper feedback, because I must commend you from the others that we've seen earlier, at least just a breath of some sense of, removing the picture from AI and coming to reality. So that's the commendation you are getting. But go back to the second slide on your results. Before I go back to your method, let me take it from there, from your method section. Yes. The sample size. Sample size, yes. So let me see. I think this previous study, it's important to always mention where. So I needed to put that out to you. The previous study, good, you said, but we don't know whether this is Lagos or Nigeria or even US. So telling us it's River State makes sense to us. Okay, so it's important to add that. I don't know if it's River State. I actually don't know because you didn't say, but it's important to mention. Then the non-response rate, I'm sure you got the correction of how it should be done. I said
Yes, you
that
said
earlier. Did you
divide
get
by
that?
0.9 and
Yeah,
apply design effect
0.9.
of 2.
Good. Then next slide should now be on design effects, isn't it? Did you apply a design effect? No, we didn't see that. You people should not be quarreling with design effects. It makes the sample
Okay.
size larger, but it makes the work better and more
Okay.
readily generalizable. Okay, so now go to your results. So this, what is this supposed to achieve? Which objective is this?
Process the knowledge amongst respondents, knowledge of rational use of
If
antibiotics
you
amongst
use these
respondents.
items to assess knowledge,
Yes,
we
ma'am.
should now see, yes, knowledge scored like this, and we should be able to say what good is. You say greater than 50%. We saw questions. How many questions made up 50%? Is what you should have told us, 5 to 6, But if you scored like that, fine. And what we can see here is level of knowledge, yes or no. What did we see in return? Where is the rational use of antibiotics? Because this looks like a cross tabulation, but this objective, we don't know what it's speaking to. Is it knowledge still? Because I was hoping to see the overall knowledge score, but this is a cross tabulation, and you're telling us that it's cross tabulating rational use of antibiotics across knowledge. So what is the rational use? We haven't determined that. We don't know what that is yet. So your objective should be sequential, just like your results should follow your objectives sequentially. That's what I'm trying to say. Okay?
Okay.
Objective
Yes,
one,
ma'am.
we see what knowledge is, we see what the rational use is before we start saying the factors associated. This knowledge, this table is supposed to tell us the summary of what knowledge is, first of all. Then we'll go and see the attitude, then we see rational use before we see anything like cross tabulation. In that
Okay,
order,
ma'am.
you don't count C and come back and count one. It's not like that. It should be orderly. 1, 2, 3, 4, so that it makes sense. So you need to
Okay.
rearrange this. Next slide. Aha. So this is attitude. Having done this, where is the summary bit of it that tells us who has positive or negative attitude? Let's see that. Okay, so now that you have this as a pipe chart, which is good, we should see what was used to do this scoring. How many of those attitude questions? You have said 50%, and that should give, and when we report percentage, actually, the way you reported it here, we should see what numbers made up this 50. How many questions did you categorize as 50 or not? Because we can see that scale you have used. You need to mention that here. Next slide. The next should be talking to use, rational antibiotic use. So where is that result? Why is the
I'm
table?
yet to
No table.
I'm yet to generate that.
Okay, so that is
Actually,
what
she's
supposed to
generating
be
that.
here. Use of
Yes, ma'am.
antibiotics before we start seeing factors associated with rational use of antibiotics. I hope that is clear. Stop sharing.
Okay.
Let's respond. We can't hear you.
Good. Hello.
No.
Wait.
Alako, why are you not responding? They're asking you.
Just answer. This one is not a laptop. Who is a community pharmacist?
Uh, a, a community pharmacist, say a pharmacist who is readily accessible in a community within the
In the
neighborhood.
community.
Yes, sir.
And what's your definition of a community?
Mm. A collection of maybe households. I don't know the exact definition, so I'll look it up.
You don't know. Okay. So your concept of community pharmacy or pharmacy program, is it having pharmacies in the rural communities or having pharmacies in the urban community or anywhere a pharmacy is a community pharmacist?
So important concept there. Very important because your work is in Port Harcourt City, Port Harcourt LG. Very important insights there. You need to go think critically of.
You're a pharmacist, right?
No, I'm not, sir.
Okay, you're not.
Yes, sir.
Because you're supposed to understand the concept. What is community pharmacy? What's the program? Because that's a specialized program designed to reach out to rural communities. Okay? So when you want to come and start doing community pharmacy program in a metropolitan state, a city and all that, I don't understand because it's expected that people, community pharmacists are in the rural areas where you have no physicians and where it's hard to get a physician, and now you want to see the rational use of the clients that attends to them, how they use antibiotics in that setting. That is what your topic is actually supposed to be addressing. But now you have carried it to situate it in a metropolitan urban area. I don't know whether you'll be addressing the intention of our rationale for your study. So you should go and find out, and then it's
Dr.
really
Kano,
on. Yes.
Dr. Kano, please let me help it. Let me help a little there.
Yes.
Let me help a little there, please. Community pharmacies.
Go ahead.
Community pharmacies are also found in the metropolitan area. Okay. In fact, if he has done a search, he would have seen a work I previously did on community pharmacies in Rivers State. And there is a clear definition of who a community pharmacist is. It's not all pharmacy outlets operate community pharmacy. Not all of them. There is a clear definition. It's also in my work. And when he now went into the community to sample, that also vitiates his understanding of community pharmacy, because he would have recruited his participants from the community pharmacies identified, from the registers of community pharmacies. They have a register. So he would have picked from there and now sample the clients coming there and not going back into the community. Because when you go back into the community, those who attended patent medicine shop are now recruited and not those who actually visited the community pharmacy. Thank you.
Okay, so that's a fundamental issue there. You must address it in your background, even in your main work. Definition of terms should clearly specify. And if you haven't done so, you need to be able to say exactly what you did. Because let it variate from what the concept is supposed to address. So it's clear. They will still pick it up. Don't think that the external examiner will come and spot it straight on. Okay, so but the good thing is that your work can at least if we do a lot of this correction being if you address them, then we can think of yes, it should be able to progress. Those that have analysis issues, we need to do a lot more work to be able to meet up. All right, so I think you can stop sharing.